Hi, my name's Heather. I'm one of the home infusion nurses with the Home Infusion Pharmacy at U of R. Today we're going to go over how to set up the Curlin pump and attach a bag of medication. So let's get started. So this is your Curlin pump. On the back is where your batteries go. So let's put some batteries in there. We're going to turn that to unlock, open that up, and put our batteries in. You'll get C batteries to replace as needed. And they both go in the same way. And then we're going to put this back on here and lock it. Okay. So the first thing you want to do is get your medication ready. So we're going to take our tubing for the administration set, take that out of the package. And there's a tab that needs to be removed before you hook up, so we're going to twist that off. Next, we're going to take the end off of your medication bag. It's either going to be a pull rubber tab or this twist tab. This is the probe. We're going to take the cap off of there. And be careful not to touch that once the cap is off because it's a sterile piece. Now we're going to insert that into the bag by pushing and twisting. Until about there. And now we're going to load the tubing into the pump. It says lift to open on the top. We're going to lift and open. On the inside of your pump, you're going to see a yellow dot, and on this side, you're going to see a blue arrow, and that's going to be the color coding for your tubing. So we have blue and yellow. So the blue is going to go into this square here. Okay. And then this yellow piece is going to go into this groove down here. And you'll feel it sit into that groove. There's an opening in the door for your tubing. So you're going to make sure the tubing is on that side. And then we're going to close the pump. All right, now we're ready to turn the pump on. That's the on-off button. And here you're going to find the name of the pump. It's going to go through the alarm checks, and then it's going to tell you your battery life. So the next screen says enter to select. It's highlighted on the word program. That's what we want. And to go through the screen, we have to hit the yes button. The next screen that comes up, it says enter to select, and it says repeat RX. When you have a repeat RX, that is a new bag. If at any time that you want to turn the pump off to change batteries, when you turn it back on, it's going to highlight resume because you're resuming the same bag. If you find it's not highlighted on the correct place, you can use the up and down arrows to move that. But right now we have a new bag. Repeat RX is what I want, and that's the yes button. And this is just going to go through what the pharmacy has programmed for you. You don't have to do anything with this. And now we have a bunch of options. We need to prime the bag to get the medication through the end of the tubing before you hook yourself up. And the prime button is down here. So we're going to push that once. And now I'm going to hold it down. And you'll hear it start to work. And you'll see the medication come through. And I'm going to release it when it gets to the end of my tubing. Okay, now I'm going to stop. So on the screen it says prime to continue or yes to exit. I'm all done, so I'm going to say yes. Now we're ready to get your line ready to get you hooked up. So we're just gonna set that aside. We're gonna use this for your PICC line. This is what looks like it's coming out of your arm or your chest. I'm just gonna take this cap off, take an alcohol pad and give it a 15-second scrub. And then I'm going to let it dry 15 seconds. Open up my saline and twist this cap off. And there's a bubble at the top, so we're going to pull down on the syringe first and push the air out. And now I'm going to push in and twist. Open up my clamp. I'm going to do a nice hard push stop and make sure you do those pauses in between. Remove that one, and then I'm going to clean again with a new alcohol pad. Another 15 seconds. Okay. Now we're ready to hook the medication up. After I wait my 15 seconds for my line to dry, I'm going to twist this blue cap off, and I'm going to push and twist it onto my PICC line. My clamp is open, and it says here, run to start. So I'm going to hit that button. Sometimes you'll get this message on here, the amount to be infused is greater than the bag volume. That's okay. We're going to just go through and say yes. All right, so this green light will always flash for you while it's working. If you notice that the screen goes dim, that's because it's just saving battery life a little bit. So this will consistently go for you. If there's an issue with your pump, it's going to alarm. It's going to tell you that there's an occlusion, most likely. Occlusions are where maybe you forgot to open the clamp on your tubing, maybe you're sleeping and you rolled and kinked your line. But once you find that spot that you have a kink and open it up, your pump will start working again for you. You do have to check your alarms, because if you don't, your pump stops and you don't get your infusion. We're going to give you a patient guide, or you can download this on the computer. In the back, it tells you some troubleshooting reasons and then how to fix everything. So if it comes up that you have an occlusion, you're going to come over here and then you're going to follow along to what you're supposed to do to fix it. So if you want to take a look at the pump now, it says there's a down occlusion somewhere. So I'm going to look, I'm going to check my clamps. Oh, looks like I have one clamped. I opened it, and it started running again for me. Another common one is your battery. So your batteries should be changed daily or every other day. It'll tell you that your battery is low once, and then you need to change them because it probably won't tell you again. If there's any reason why your pump alarms and you can't figure out why, you can call home care and have them give you some assistance, or the home infusion pharmacy will be able to help you.